Good evening. As we continue to battle coronavirus, a lot of people have been trying to figure out what the worst case position actually could be. And I don't think anybody actually has a clear answer. And we keep trying to figure out what are going to be the number of cases in India a few months from now, by February 2021, by the end of 2021. And the correct answer is we can't really tell because it depends on a number of factors. Is there going to be a vaccine? How effective are measures taken by the government going to be? Will a large number of people start to practice social distancing and the use of masks? Will there be enhanced testing and contact tracing? But at least there's one really scary study that has been done by MIT researchers right now. I have to warn you, it's not been peer reviewed, it's still very initial. But that's in particular pointing to a very scary trajectory for India, saying that India could become one of the worst affected countries in the world with coronavirus, with something as high as 2.87 lakh cases a day by winter 2021. That's at least what the report seems to be saying. Now, I think you have to judge that with what the reality today is. India is already the third worst country in the world when it comes to new cases, and the new cases are continuing to rise at about 20,000 or thereabouts per day. Now, is it going to be 10 times that, a few months or a year from now? I think it's too early to say, but it sort of indicates how bad the situation could get. And it also illustrates how some of the states which have been taking it perhaps somewhat likely till now, not worrying so much because they don't have coronavirus cases, states whether it's Karnataka or Tamil Nadu or Andhra Pradesh, or even states like Bihar and Uttar Pradesh and others which have not had to deal with it, people should take note of what the worst case situation could be. And then we've got to try and make sure that this doesn't actually come to pass. So this MIT researchers report causing a lot of concern today, but I think you do have to have that, quite literally, a health warning saying that it doesn't necessarily have to be that bad if we all continue to take the precautions that we are taking. All right, let's now quickly take you through all the big stories of the day.
Researchers from the Massachusetts Institute of Technology claim that the number of COVID-19 cases recorded per day in India may rise to 2.87 lakh by early 2021 if a vaccine or treatment isn't developed soon. Although USA is currently the worst hit in the world, the team from MIT's School of Management says that India will surpass US soon. According to their prediction, daily new cases will be second highest in the US by Feb 2021 at 95,000 per day, followed by South Africa, Iran, and Indonesia. The same study also claims that the actual number of cases is 12 times higher and the death rate is 50% higher than the reported numbers. Even so, all nations are still well below herd immunity levels.
Lockdown will be imposed in containment zones in West Bengal for 7 days from 5 p.m. on Thursday to check the surge in novel coronavirus cases. Chief Minister Mamata Banerjee said on Wednesday the situation will be reviewed after 7 days and the next course of action will be decided. Banerjee said if it is seen that the number of cases are coming down during this period, then some relaxations will be announced. She urged people to maintain physical distance and wear face masks. Mamata Banerjee directed the police to be strict with those violating norms and send people back home if they are found without masks. The West Bengal government had on Tuesday decided to expand the areas under lockdown and impose tougher restrictions from the 9th of July to stem the relentless spike in COVID-19 cases. Due to the alarming surge in COVID-19 cases in Bihar, the Patna District Magistrate has ordered a complete lockdown in the city from the 10th of July to the 16th to curb the fast-spreading pandemic. Bihar has so far reported 12,570 confirmed COVID-19 cases, of which 104 have succumbed to the disease. As of Wednesday, there are 4,179 active cases in the state. A Delhi court on Wednesday granted bail to Chinese, Brazilian, Australian, Fijian and Philippines nationals who participated in the Tabligh Jamaat congregation at Nizamuddin in Delhi in March. They were granted bail on a personal bond of 10,000 rupees each. They have also moved a plea bargaining application before the trial court. Plea bargaining is a pre-trial negotiation between the accused and the prosecution where the accused agrees to plead guilty in exchange for certain concessions. This came a day after the court granted bail to 122 Malaysian nationals. All the foreign nationals had participated in the congregation in alleged violation of visa norms and guidelines issued by the Indian government on COVID-19. Jharkhand Chief Minister Hemant Soren has quarantined himself at his Ranchi residence after a cabinet minister whom he had met recently tested positive for COVID-19. The Chief Minister had recently come in contact with Drinking and Sanitation Minister Thakur, who has tested positive. Soren has also urged staff members of the Chief Minister's office to undergo home quarantine. The Chief Minister's samples are expected to be tested during the day. In a first in the country, Mumbai will outsource its ICU services in government jumbo facilities to private bidders to address the staff crunch as COVID-19 cases continue to rise in Maharashtra's capital. The first batch of patients to move in such facilities under private bidders will be from Thursday. As per the latest decision, private doctors and hospitals have been invited to bid to serve at the government jumbo facilities, and the BMC will pay between 6,000 to 6,900 rupees per bed to the private bidders. The BMC will provide infrastructure and medicines, while the private bidders will have to bring in their own staff. The bidders will have to adhere to the Medical Council of India guidelines and work orders that have already been issued for the jumbo facilities at BKC, Nesco, Mulund and Dahisar.
A Spanish study published in the Lancet journal has cast doubt over the feasibility of herd immunity when enough people become infected with the virus to stop its spread as a way of tackling the COVID-19 pandemic. For herd immunity to work, at least 70% of a population needs to be immune to protect the uninfected people, experts say. The study of over 60,000 people has found that only 5% of the Spanish population has developed antibodies. Most of the population remains largely unexposed to the virus, even in highly populated areas, according to researchers, including those from the National Center for Epidemiology in Spain.